the risks include sometimes the output from some of these products can be either wrong or biased. So actually several of the audience members asked about like how frequent hallucinations are, and it's definitely not zero. It's getting better. Um, so and there's different levels of risk depending on which technology you use. Like, so for example, if I see you as a patient and I'm writing a note, a lot of the vendors of these technologies make it really transparent so that the transcript is right there. So if something seems like off on your note, you can click on a word and just like go to that part of the transcript and it'll show you what you said. Or and you can even listen to it again. I mean, a lot of people, it wouldn't end up saving you time if you did that a ton. But so, I mean, I think one of the things I would recommend is to look for how you're going to monitor that and how you're going to, and just to make sure you like drive home to the clinicians that are using it, that they need to check the notes and make sure there's not missing information. It's sort of easier to check like wrong things than to like remember. Sometimes it leaves things out too, which is a little bit harder. The other probably like more risky technology is sometimes the chart review technologies. There's not really a way that you're going to be able to like look through hundreds of notes and make sure the AI was correct. So that's a little more nuanced into just making sure that if you're making clinical decisions based on this, that you maybe like check those pieces at least. And I think some of the technologies do like sort of reference like which note it came from, so you can check. Maybe this isn't a risk, but this is like potentially some people have brought it up, is sort of de-skilling. So, for example, a lot of us think when I go write a note, type a note later for a patient counter, I often like think of other things that I hadn't thought about, like more diagnoses to consider or different treatments that might work better. And so I think some people worry that we'll lose that sort of cognitive process. And particularly amongst younger physicians or our trainees, like our residents, we worry about that a little bit. And I also think that maybe that de-skilling part, I mean, I think this generation of physicians that are training now are growing up a little. I mean, it's like us saying when I first started, we didn't even have any HR. We did everything on paper. So, and I mean, people were concerned then that, oh, people aren't going to know how to like handwrite a prescription anymore. Well, who cares? Like, so I think some of that is going to be sort of a who cares moment, and some of that might be real. So all these, AI large language models are trained on data. And if the data going in is biased, then you come with biased output. So you just have to be careful about that. And that's not something you can usually control on an individual user basis, but you have to ask questions to the people that make these products that they're safeguarding against that. And they're also really costly. So that's another disadvantage. So in terms of concerns, I think the big question is, there's going to be a lot of data out there and a lot of people's voices out there. So I guess all these things get stored somewhere. So data breaches and privacy breaches are a concern. The other thing is these large language models require huge amounts of computational power. That's very costly. And it's also, there honestly are even like climate change implications for that, for using so much computational resources. So I think those are concerns going forward. I think the technology is just getting better and better. That's the exciting part. For example, the AI ambient documentation / AI scribe technology will now very soon on all of these vendors' roadmaps will be the ability for it to like enter your orders at the same time as so not only like if you and I talk about, your anemia, it would enter a CBC like right there. So that's coming actually pretty soon. So that's already being tested. So that will also be a huge time saver, because that will, both be a huge time saver, but also even be more like time that you're actually looking at your patient and not typing. So, yeah. And the other thing about cost and these is that, the other option for doing this is to use an in-person scribe or a virtual scribe on the phone. This is way cheaper than that. It's like a tenth of the price. So don't quote me on the actual thing, but I've been told that it's like a minuscule fraction of how much it costs. Be excited, first of all, and be like, I think this really has the opportunity to bring the joy back into medicine. So I hope that I hope this will encourage more people to go into primary care, because one of the things that my residents always say is that they're worried about the burden of, for example, in basket and documenting, the 10 or 12 patients that they saw in a half day. So I hope this will help that. I also just a caution would be I worry a little bit that there's going to be sort of automation bias where people just automatically assume that like if it's, if the AI outputs the correct content for the first 9 times, that 10th time it might be wrong. So you just caution to like really be vigilant about making sure these tools are accurate and that you're having these checks